My name is Bandana Sharma. I'm a family doctor. I work at Virginia Mission University Village. I'm a primary care physician. I choose primary care because I believe it's the little things that matter more in life. For example, when my patients come to me, I'm mostly doing screenings and preventive care, blood pressure checks and blood sugar checks, and smaller things like that. But it's the combination of all this preventive care, the chronic care that makes up for a healthy patient. I am basically a general family physician, actually, but here I work with internal medicine department. So I'm seeing young adults and geriatric patients. I treat everything from little laceration to birth control to hypertension, diabetes, and pretty much everything. I'm very passionate about preventive care. I believe we have to have a system that takes care proactively and not reactively. So I would like to strengthen the preventive care of my community and keep my community healthy. It's a great time to be in primary care. I love that we are starting to think proactively than reactively. Being proactive means taking care of your preventive care, and then being diagnosed early if there is anything, so we can take care of it before things get bad. Next thing I'm excited about is the innovation, the pace of innovation in primary care field. Now my patients get to be in their home and get care from their providers. Now my patients can get their prescriptions electronically, and now my colleagues can share notes with me through the same electronic medical record system. And my patients can really email me via their portal. So that's very exciting time. And then I love that innovation is happening in primary care. Being a primary care physician, my patients walk in when they are healthy, and then they walk in when they are not feeling that great. And many times they walk in healthy, I order some tests, and we find out something's going on with them. So that's not the favorite part of my life, because it is difficult to give my patients who otherwise didn't know that they were going through some elevated blood sugar or some other diagnosis. So when I relay this message to my patient, it's that moment, that trust, again, that we have built over time that helps me to take care of my patient and help them understand how to go forward and how to stay positive even when things don't go right. I'm always inspired by my patients. I love learning and being with people. I'm learning new things every day. The struggles they go through teach me how fortunate we are and how to embrace what we have. And the positivity that I see in my patients. I give someone a cancer diagnosis, and then that strength they have, that positivity to go through treatment, is what I learned the most from my patients. I chose Virginia Mission because I love their vision, the vision about safety and quality and keeping the patient at the top of the pyramid. It's so important that we keep our patients at the top because it's their life, it's their body, and we are just a little support system along the way in their life. When I meet my patient for the first time, I like to introduce myself. They deserve to know about me, just as I deserve to know about them. That's when a best relationship happens between a provider and a patient. Because in this field of medicine, trust and relationship is very, very important. Unlike other specialty, my patients keep coming to me over and over, and it's about having that special relationship with their physician that makes them want to come back. Team medicine is huge in Virginia Mission. We have a team of 500 physicians, and all of us work together. We share a common electronic medical record system, which means my colleagues can see what my plan for the patient is and why I'm sending them. And I love that they're at my fingertip. I can message them, call them instantly. And there was one Sunday where I needed help with my patient. I called the chief of the department, and he answered me within 2 minutes. And I love that about Virginia Mission's team medicine. When I interviewed at Virginia Mission, I felt very welcomed. I also love that it's where I live, it's in my community, and I wanted to be part of my community's health. And the vision that strikes me is safety and quality of patient care. It's very important for us to realize we want to be able to provide safe, and our patients deserve quality care. When I'm not working, I'm busy with taking care of my kids, running errands at home, and I love everything about cooking and being home with my family. We also love to travel as a family. I'm a lifelong learner, and I love meeting new people, learning new culture, trying out their food, and just being in different places around the world.